most people will. The hardest part is, now is not a convenient time. Can you call me back tomorrow? After 5. We get a lot of that. This is just a sample letter for the primary care provider to refer for speech and language, and then the next one is for the primary care provider to refer for counseling. Can we refer a person directly to counseling, directly to speech and language, and not go through the primary care doc? Yes. The answer is yes. But when we set this up, it was all based on the primary care medical home model. So it was all based on, all right, we're going to go to the primary care doc and then develop the relationship, and that person will refer back. Some of the challenges, participation in the quality of life survey. So again, we don't harass people. We try 3 times to contact the person over the phone over a period of time. But we have found that immediacy is really important after the screening. If you wait more than 2 weeks, especially for an individual with a brain injury that is screened likely, they may or may not remember the event. And if you wait too long, they're probably not going to be all that interested, and they're not going to be clicking into what it is that you're asking. So we try to follow up with that quality of life survey within 2 weeks. Some of the other challenges: access to care, where to refer, follow through, and then obviously case management. There is no case management component. We only go so far. And obviously, when I tried to answer your question, you were really getting at case management, and we don't have the personnel to be able to offer that. Let's see. Making sure that we get good contact information at the time of the screening. We ask for email. We ask for telephone number. You can imagine with the homeless population.
What I was going to say.
There's you're not, yeah. That email, that telephone number might have been good for a day or 2 because it's a friend that has a phone that's purchasing prepaid minutes. But if you wait too long, that number has been disconnected, and you're not going to be able to contact that individual. So following up with a homeless population is extremely difficult. And I've learned a lot about the people who are homeless in that there's 3 camps in Idaho as it relates to homelessness. There are people who, when the weather turns cold, they move out. They move to warmer temperatures. There are other people that are more transient. They're kind of in and out, but they will look for shelters, in the community to stay at. And then there are some people that, basically they will look for any shelter that's available and will stay in place and reside 12 months out of the year in that community. So make initial contact as soon as possible after the screening, make several attempts. I put 3 at a minimum, but we don't, like I said, after 3, we typically don't follow up after 3 contacts. I have had people, after we've made 3 contacts and been unsuccessful, I've had people 2-3 months come back and say, hey, are you still offering? And we do. There's the gift card. Obviously, many of the people that we've screened, they don't have health insurance. We will provide, as part of the referral station, we'll provide people. Idaho has a state health information exchange. We'll let people know. We'll give them the telephone number as well as the website. And we have a suicide prevention 1-800 number. And we have a referral list broken out by category: mental health versus everything else. Develop relationships with primary care providers, specialists willing or chartered to see patients without insurance, and then seeking a private funding partner if a trust fund is not available in your state. These are community partners. So I mentioned in Meridian, it's Unity Health Center. It's a husband and wife team, primary care doc. They're a private practice. They have no specific charter to take the uninsured, but they will. And they will take a person for $50 for an office visit. That's about 30% of what you would typically pay for a primary care office visit. Health West is part of Hearst's Health Center program. We've talked about the clinics. And then there's our private speech and language pathologist in the community. 2 years ago, we went to the Blue Cross of Idaho Foundation, and we said we are screening many people that have no health insurance, and they don't have the ability to make co-pays. Even though the primary care doc is discounted to $50, $50 is a lot of money to some people. So Blue Cross of Idaho, they didn't give us much. We're going to go back to them again. They gave us $500, which, you know, it helped 10 people. It helped 10 people that screened that didn't have the means to be able to pay. This is available. Don't be afraid. Don't be afraid to go to the insurance industry and ask them. They have money. Blue Cross of Idaho has foundation money, and you just have to figure out what their priorities are and get to the right person. And then you've got to be able to document that, look, the need. Some of our ongoing challenges. Getting individuals to follow through on referrals. Getting neuropsychologists willing to take referrals. We have 2 large hospital systems in Idaho. We have St. Luke's and we have St. Alphonsus. St. Alphonsus is our level 2 trauma center. St. Luke's has a 1-year waiting list on a person with private insurance to get a neuropsychological evaluation. Can you imagine if you have no health insurance and you're trying to get a neuropsych to diagnose? It's extremely difficult, extremely difficult. So what I found is that we took, in Idaho, we opted to serve people, kind of the hardest of the hard. People, when you have no health insurance, to develop referral pathways is extremely difficult. We know how hard it is for people that have some private insurance or TRICARE, if they have a military background, and what the limitations are inherent with that. Anyway. Again, there's no mechanism. Idaho has no state money for traumatic brain injury. None. No state money. Yes?
Do you use neuropsychologists or do you use PhD candidates for neuropsychology?
I've tried to. Health West. I've used. So we've had students that went through the psych department in Pocatello that are now working for Health West. And there are 2 of them that can take our referrals on the eastern part of the state, and that's as close as I've been able to. I mean, that's the best I've been able to do. I don't have a neuropsychologist right now that will say, you know, I'm retired, but I'll take 3 of your folks, or I'll take 5 of your folks, because I'm not looking at big numbers.
Right.
I just want some help, but it's pro bono, and when a neuropsych can build private insurance versus getting nothing, they're going to build private insurance.
With all the data that you are getting,
Yes.
through this Medicaid waiver and also through this public law, are you planning on advocating to the legislatures to have some funding for services for individuals with TBI in Idaho?
Yes, Idaho needs a trust fund. Idaho, so does Oregon. Oregon has tried, Idaho has tried. It's been a while since we've tried. But we need a revenue stream that's non-traditional. 24 states have trust funds around traumatic brain injury, with Washington State being one. Those trust funds are funded from fines, surcharges, and fees attached to motor vehicle infractions. We tried that in Idaho, and that's viewed as a tax. And we have an extremely conservative legislature and government. So we have to find another way in to be able to do that. We're trying, because that is the piece that.
Sometimes the data helps drive the funding, and that's the reason.
Definitely.
Since you now have the data, that will happen.
Definitely. Yes. Thank you. Okay. Well, I guess that's it. So we're a little early.
Russ, is the data, are you guys looking at any projects, looking at outcomes of early identification? Since you're doing the screenings, so maybe a longitudinal study where you're going back and maybe even
you know, I'm gonna work with Corrigan, because I don't know what the number of states that are using the tool that he developed, but I I think there's quite a few. I think there's 15 to 20 states that are using this tool. So I wanna talk to John in Ohio, and I wanna say, John, he's got a model systems grant, and I wanna say, John, can you put some of your graduate research, I'll share my data if Idaho can be included along with whoever, Colorado's done a lot in the juvenile justice system. I mean, can we start publishing and getting this information out there? Yes. Yes. Yes, sir.
You know, I guess I just kind of like to get a recap of what I've kind of picked up here. It sounds to me like that you applied for grants. The grants really are insubstantial, but it's the first real money you have. So you had to use that to build your infrastructure. And then you're using students at various levels to provide volunteer employment because you don't have anyone you can pay. And I'm going along with this, I'm an RN, I get all this. So I'm just trying to get a recap because really the big thing I picked up from this isn't about whether we're referring or doing anything, but you're really trying to build a system from the ground up with no funding.
That's right. That's right.
And that's kind of what I picked up from this
That's
today.
right.
Was
That's
more that than.
That's right. If you were only there 4 years ago, because I was extremely frustrated, because all of those referral pathways were not in place. And I had to figure, and it kept me up at night, there's a way. I mean, if you're diligent, if you just keep chipping away at it, it's not perfect. I mean, it's a long way from perfect. And again, PT and OT, they're not, we want them. We want that part of the screening, and there's just a lot more that we can do. But, we're going to continue to build the data that we have. We're going to continue to continue to try to advance it through the public policy, because both research and public policy, get it in the literature, get it in public policy, get it in the state legislature. Thank you. Yes?
Have you done any collaboration with your correctional system?
I have not, only because so under the Obama administration, Idaho had, that was 2013, 14, we had 200,000 people who were uninsured. 200,000. So we're down to now so Idaho just passed, I don't know what it looks like in total, but they just passed, because there was a citizens initiative that was passed in October, so the legislature had to do something to provide Medicaid for the working poor. Single people who make less than $17,000 a year. So it's going to cover, I think, about 60,000 people. They're going to put side rails, though. So these people will be eligible for Medicaid, but they're going to put strong work requirements in there, and who knows what else. I've yet to look to see what the final bill, looks like, but I believe it's passed. And our legislature didn't like the fact that the citizens of Idaho, at 61%, said, we believe that there should be Medicaid expansion in the state. They didn't like it. They didn't like it. They didn't like it. Yes, ma'am.
For what you just said, if you have a brain injury and you're homeless, you're not going to be eligible for Medicaid and you can't work.
Well, you might be eligible for Medicaid.
If you're not, you said they were going to require you to work.
Oh, I see what you're saying.
And if you can't work and you have a brain injury and you're homeless, you're still without Medicaid and any insurance.
Yeah.
But also
yes.
along with that, here in Spokane, they have various health fairs, like at schools or Salvation Army or different places, and WSU brings student nurses and pharmacists and that sort of thing. Would it be appropriate to ask if they bring in someone who can evaluate for brain injury?
Sure. Anybody could go out there, learn how, you don't have to be a rocket scientist. Anyone can go online, learn how to ask those 5 questions, how to score it, and then because to answer your question, our job is to figure out how do we get it into the service system. I'm going to present to voc rehab counselors in October, and my presentation is going to teach those VR counselors how to screen for brain injury. All of them won't be required to screen, but some of them may pick it up.
Good.
Some of them may pick it up.
You've got DVR, Department of
Yes,
Vocational
yes.
Rehabilitation.
So VR is one
Because they
mechanism.
should use.
Sure. I mean, any place in the service system where you can, you know, where you can impact, where you can raise awareness as it relates to brain injury, is a good thing. And for me, those health profession students that are going out there as PAs, they know how to screen for head injury. That's the
Like
beauty
the
of it.
nurses.
The nurses, dietetic students,
Okay.
the ones that have, you know, gone through ISU, they know how to screen for
Well, they
head
have,
injury.
like, those plus pharmacy students who
Yes.
go around and take blood pressure
Yeah.
and test for diabetes and, you know, various things like that. So maybe they could add brain injury to that.
They certainly could, you just, you know, it's not, it's, you know, and the selling point is, unless a person presents, you know, some very, you know, more complicated issues, it can be done in 3 to 5 minutes. That screening tool is 3 to 5 minutes. It's not labor intensive, it's 5 questions. So anybody can do it.
And can they contact you for the information?
On how to do it?
Yeah.
Sure. Sure, I'd be happy to. Yes. Yes.
What visual screening methods work? Like CT and MRI don't show anything. So is there anything new that, any scans that would work to show TBI? Because I've heard about like an MRI TBI and those more advanced scanning. Do you know much about?
I don't. I know there's advanced scanning out there. I know there's, you know, I know there's testing. I don't know if, you know, I don't know if every hospital has the ability to be able to provide that or how much it costs, but I know that technology exists. But I can't speak specifically, sorry.
There was a lecture on Gonzaga the other, at Gonzaga, the lecture the other day by Dr. McDonald about that exact thing. And the short answer is it's called DTI, is the current name they're giving it. The advanced MRI is pretty good. There's like 6 machines existent or something small. But yeah, we're not going to see this in the state for all of it.
So screenings, you know, again, it's just one aspect. So under the prior grant, we had to do screening, professional training, service arrangement coordination or case management, and resource facilitation, I think was the 4th. Anyway, there were 4 core services. And some states could, you know, offer those kind of in isolation within certain, you know, activities within their grant. Most states, I think, provided kind of wraparound services. They lend themselves to wraparound services for people. If there's nothing else, thanks so much for coming. Yes, sir.
Something a little unrelated. One, if you're familiar with it and anything on it, is the high flow oxygen, like the concentrator tank used for cluster or migraine headaches,
Yep.
and the problem with Medicaid not paying it for it because of the on-demand nature
Yep.
and the previous COPD
Yep.
stuff. Anybody making any headway? Because as far as efficacy versus side effects versus cost,
Yep. So I have a good friend in Pocatello that has a 21-person chamber.
yeah.
He has a diving background. And
Well, I wasn't meaning a hyperbaric, I just
Oh.
meant like the normal concentrator. Medicaid won't pay for a concentrator at home because it can be used, or a tank, because for a headache, it can be used on the, you know, not constantly. But then way back when, they let people use it not constantly for COPD, and a bunch of them died. So now they have this whole thing where they won't pay for it. The best treatment, the cheapest treatment, and they won't pay the $50 a month for oxygen, but they'll pay the $900 for probatriptan.
what I would do is go through your insurance, your Office of Insurance here in Washington State. Figure out who's the key contact person in the state of Washington, in the Department of Insurance, and either yourself or someone that has a connection with that individual, sit down, explain the situation.
Department of Insurance?
Yes.
Excellent.
They were here today. And
You're talking about someone in
Really
Olympia.
awesome.
I don't know where it would be in.
Well, that's our state
Okay,
capital.
yes,
Figure that out.
I
yes,
just have
yes.
one last question. You
Yes.
mentioned suicide earlier, and I know that you have statistics on the homeless. Here. Do you keep any on suicides in TBI?
No, not under this data set, not within this data set, but I have some statistics, mostly that have come from on the military side.
Oh, yeah.
And Idaho was like top 3 or top 5 states for suicide, yes. Which is why we've seen money that's gone into staffing a 24-hour suicide prevention hotline, yes.
Top states in the nation?
For suicide, for the number of suicides. It's not a good thing, it's not a good, yeah.
And is that military or all in general?
I believe it's all. I believe it's all.
In your,
Idaho's up there.
in your experience, when you say putting a name on some of the symptoms for people or a potential name provides some relief, even beyond the later steps, like when you screen somebody and you're saying, you know, these things you've been experiencing might be this, do you find that
I find it's
that's a
helpful.
benefit?
I find it's helpful when a person is insured. I find it's helpful because I've seen where it has resonated with people when they start looking at the list and they say, oh my gosh, yes, I've had this, I have this, I have this, I have this, and they start checking off. And then I take it the next step and I say, now do you believe that the symptoms you're having, I'm not a doctor, but do you believe that it's a result of your head injury? And then if they say yes, then I'll move in, even further. But again, this is lifetime history. So if a person had a head injury 25 years ago, they fell off their bike and they got their bell rung, because they weren't wearing a helmet, and they saw stars, that'll show up on the screening tool, but they may not screen likely for head injury. Even though we know a concussion is a head injury.
Oh, yeah.
No brain buckets in Idaho.
Right. Yeah, our big initiative is e-scooters. E-scooters. So at the city and town level, we have,
Wait,
so I testify.
They're not subject to the laws of physics, are they?
Yeah, I know.
Because we see them as a recruitment drive for the support groups. They're going to be flooded.
The sad part is I testified a few weeks ago in front of the Meridian City Council, and I obviously came at it from a helmet, especially for minors under 18 perspective. But I had the chief of police get up and say, we're dealing with drug traffickers that are passing through the state. We've got our hands full. We can't monitor that. We can't. And then I got the bicycle safety guy with the city that said, oh, it's going to discourage ridership. And I don't know. I wanted so bad to say,
It's Idaho.
Yeah.
if your children don't want to brush their teeth, you just stop telling them to brush their teeth. You tell them they got to brush their teeth.
They ignore them, they'll go away.
But we'll see. Thank you all for coming.
Thank you for what you do.